HCA is preparing for COVID-19 outbreak by multiple strategies. We have developed a core group of subject matter experts to be able to provide the latest information to our nurses, to our staff, to our physicians, utilizing the latest guidelines from national organizations.
When a patient is suspected to have COVID-19, we immediately isolate that patient, and then we work in conjunction with our local health departments and possibly even the CDC to make a determination whether we conduct COVID-19 testing. When our patients and families enter the emergency department today, they will be greeted by one of our colleagues, and that individual will be wearing a mask, and then they will be asked to answer a few questions, and those questions will be centered around their travel history, their current exposure to COVID-19, and then if they're experiencing any flu-like symptoms. And if they screen in yes to any of those questions, we will also ask them to wear a mask as we continue to provide medical care.
We're very well prepared to deal with any influx of patients. We have the right staff, we have the right process in place, and we have educated our physicians and our nurses to understand what COVID-19 is and to be able to manage it appropriately.
So COVID-19 is a type of coronavirus, and coronaviruses have been around for quite some time. It's just one of many respiratory viruses. It happens to be a new one that we hadn't seen before. It originated in China and seems to be spreading very quickly. So I imagine we're going to be pretty used to having COVID-19 as a household name pretty soon.
If you have traveled to a CDC hotspot, I recommend that you contact your local physician or nurse practitioner, and if you're one of our colleagues, I recommend that you contact your hospital leadership team before returning to work. If I was making plans to travel to one of the CDC hotspots, I would consult with my medical provider to determine if they felt like it was appropriate for me to travel. A patient may have comorbidities or pre-existing conditions that made it inappropriate for them to travel to one of the hotspots.
Coronavirus symptoms are similar to influenza virus or the common cold, with having a cough, sinus congestion, shortness of breath, muscle aches, body aches. All of the common viral syndrome is similar in COVID-19 or the coronavirus.
So the individuals who are most affected by COVID-19 are those with impaired immune systems and the elderly.
At this time, currently, we do not have a vaccine for the coronavirus or the COVID-19. We do have treatment to be able to at least treat the symptoms patients are experiencing. What can you do today to keep yourself safe? I think the key things are to be able to make sure you use proper hand hygiene. We have all heard it, but it's extremely imperative that we take the precautionary measures of always doing proper hand hygiene. The other things that we can do is to make sure we stay away from any contacts that might have respiratory types of symptoms like cough, congestion, and to ensure that if we do come into contact, we take all precautions.
An individual that has COVID-19 has an isolation period of at least 14 days.